Oh my God, exams. Welcome to Aplastic anemia. On my left is the classification of aplastic anemia. Classification is an aid to orderly thinking. Hence, I would like you people to kindly by heart this classification. It can be idiopathic, drug-induced. So, idiopathic again can be divided into the inherited, physical agents, chemical, and viruses. And there are a plethora of drugs which can lead to aplasia. I would like you people to kindly memorize this as much as possible. Secondly, you find that aplastic anemia, the term was coined by Ehrlich in 1888. The basic mechanism can be because of the reduction in the number of cells, defect in the stem cells, defective environment as in the viral infection, immunological mechanism, idiosyncracy. There will be a reduction in all the elements that we see. Severe aplasia will be having WBCs less than 500. Normally it is 4,000. Platelets less than 20,000. Normally it is 1.5 to 4.5 lakhs. And reticulocytes less than 0.5% or even absent. Marrow cellularity is less than 25%. The degree of the bone marrow suppression depends on the severity of the causing agent. However, there is one element called as idiosyncracy. When we are exposed to the insulting agent initially, the damage is not much. But subsequently, even when there is a trivial exposure to this, there is a severe reaction which is called as idiosyncracy. This happens in the case of chloramphenicol, which can result in massive aplasia. The clinical manifestations will include lassitude, dyspnea, and tachycardia because of decreased RBC, infections because of neutropenia, and bleeding manifestations because of thrombocytopenia. The blood picture will show a picture of pancytopenia. That is, all the elements of blood will be reduced. RBCs, WBCs, and platelets. The bone marrow picture is one of the most important things that we should describe. Whenever we describe a marrow, there are certain subheadings. One is cellularity. Here in this picture, I find that there is a marked reduction in the cellularity. Almost 90% of the marrow or even more is replaced by fat. These are the bony trabeculae. The gross appearance, it will be appearing more yellowish than reddish because the elements of erythroid precursors are not seen. Cellularity is hypoplastic or even aplastic. And sometimes we'll be getting what is called as a dry tap. Erythropoiesis is suppressed, leukopoiesis is also suppressed. Lymphocytes and plasma cells are relatively increased. Even they may be normal or decreased, but they are less so than the WBCs or the neutrophilic series. Mitosis absent, megakaryopoiesis is also suppressed. Iron stores are almost reduced and abnormal cells are not seen. There is an element called as pure red cell aplasia. Only the red cells are decreased, and this is described by diamond and black fan, otherwise called as diamond black fan syndrome. It may be associated with thymoma. That is given over here. Fanconi's anemia is another type of anemia wherein there can be cutaneous pigmentation, neural, renal, skeletal manifestations. This is because of a defect in the DNA repair. Normally, in a blood picture, in a case of aplastic anemia, the hemoglobin will be less than 7 grams. And the marrow picture we have already shown. Course and prognosis is quite severe and serious. unless the insulting agent is removed. Secondly, if it is still refractory to treatment, there should be a bone marrow transplantation or a stem cell therapy. These are the manifestations of the aplasia. Finished with class number 13.